Hey guys, it's Dr. Anderson at Life Centers Chiropractic in Missouri City, and today I'm going to talk to you about how to determine the cause of all different types of hip pain. So the hip joint and what people refer to hip pain can be all sorts of different ways that it presents. Some people feel it around the back of the hip, glutes, or SI joint. Some people feel it on the side and it's achy down through the side of their hip, or even might refer to it as their IT band. They might feel like they might be getting IT band pain, which can even be here or run down. Some people get pain in their hip flexor group, which is like a muscle and connective tissue, tightness and stiffness, but also that can feel very similar to in your hip socket, where you might have issues where the hip socket has become impinged or even torn or degenerated. So there's a lot of different things going on in the hip, and I just want to kind of shed some light on how to tell the difference. And regardless of which one it is, we get awesome results at helping with all of them. So if you look at the anatomy of the model, these two bones are here. So when we walk, our hips naturally just walk, they go back and forth. So the natural motion of the spine is rotating back and forth, back and forth. So there's these two hip bones, which are called your ilium, and there's this big triangular bone called your sacrum, and where they meet, they make a joint, and that's your SI joint. So if you ever heard of your SI joint, that's what it means. It's the joint where the two things come together, right? So this rotation, the spine can actually get stuck in that rotated position, or the sacrum can tilt many different directions, and that can create impingement in the SI joint. It can create spasms and knots in your glutes and piriformis. It even cause issues with the front where the femur goes in, inserts. That's actually the socket where your leg bone goes in and connects to the pelvis. So if this bone's rocked or misaligned, it may cause pain here, or it may cause pain in the socket, or it may cause line, or it could be all three, right? So one major thing that we always like to do is evaluate through x-ray and posture evaluation and orthopedic testing, the alignment and symmetry and motion of the ilium and the SI joints. So I'm going to demonstrate that on a patient here. So she's going to go and lay face down, and she's already had a full exam and spinal imaging, and she's been in care for a long time. So I know that currently where she's at is her left hip or ilium is in rotation this way, the right one is going this way, and her sacrum, because that is also tilted. So how we correct that, there's a couple indicators that we can check. I'm going to have her slide them just a little bit, and first, we're going to check the leg lengths, and we'll be able to see that when that hip is rotated, that leg will shift and become longer than the other. Another thing with the sacrum is when we bend the knees here, and bring the heels towards the hips, one leg will go a lot further than the other, and that indicates the side where the sacrum might be rotated as well. So today, how we're going to adjust that, there's two different ways that we're going to adjust it. One is called a pelvic drop piece. It's loud and it makes noise, but it's actually very gentle, and it just simply uses gravity to just sort of align the spine or the pelvis with itself. And this is one where there's not any popping or cracking noises or releases like that. It's just repetitions of gravity falling and gently leveling the pelvis. So as a pedal, props at the piece, we contact the two different hip bones and we drop them a few times. And then on the sacrum, we're also going to drop that. All right. Now we can reevaluate, and we can see that the legs are back in line, which is great. And we'll check the symmetry of the SI, the heel to pelvis, and that's looking much better too. So that's one way. So another way that we might adjust the pelvis is we'll have her turn her side facing me. And we do what's called a side posture manual adjustment on the pelvis. So we're here, and again, we're just gonna very gently contact that joint. And I'm just gonna gently align it. And that will create a nice release of pressure. Actually feels really good to just set the alignment. So that's the most helpful things for the SI joint, the back of the pelvis, the ilium, and we wanna level that. Now she's gonna lay her back. Another thing that she has, and that's very common, is that there might be pain or irritation of the lateral part of the hip, and sometimes even radiates to the side. Many times, you might have a stiff IT band, but if you stretch it and you stretch it and you stretch it and you foam roll it, but it always seems to come back, that's many times due to some rotation that occurs inside where the femur goes into the pelvis in that socket. And that's also a pretty simple thing. It's very, very, very effective for people that have had that chronic pain there. So we're simply just going to raise the leg, and we're just going to drop it a few times and de-rotate where that insertion point is. So this is very effective for the lateral hip pain. And we're just simply gonna drop, drop. And that's a really effective adjustment for lateral hip pain. Now, another one that we see very common is impingement or irritation where the femur goes into the socket itself. So this is where we're going to just simply contact here. We're just going to gently distract and just create a little separation and gapping to center that femur with itself as well. So we're just going to very gently pull, decompress, and distract and take pressure off that joint. Very good. So those are some really common ways to actually help the pelvis. And anybody with hip or pelvic pain, typically we get almost 90+% success rate of helping. There's one more issue that might come if there's an issue with the actual hip flexors and tight hip flexors. So here, I'm gonna have her take one knee up, a simple orthopedic test where she can just cradle this knee. Now what you want to see is this connection point, when it's at its normal length and tension, the leg should very comfortably just fall to the ground and relax. Now you can see that her femur is not touching. There's this huge space where that's not touching the ground. And what that says is that this is actually shortened. So in this scenario, there's some specific stretches we'll do, which we'll demonstrate in another video, where actually lengthen the connective tissue, and over time, you'll be able to see now, as if it was stretched, you would see that now if it was normal length, you would see her femur actually come down very naturally and gently and touch the table. So we'll show you how that works in another video, and those are some things you can work on at home. So I hope that helps.